Hello, this is Cassie from the SHR News. There has been a recent breakthrough in the study of the rough endoplasmic reticulum. This organelle is responsible for the production and storing of new proteins in the cell. This ribbon-like structure, plastered with ribosomes, is found around the perimeter of the nucleus, allowing it to easily send newly made proteins anywhere they are needed, whether that is inside or outside of the cell. Recent discoveries show that a certain gene that causes the dysfunction of the rough endoplasmic reticulum can also be the reason that people develop cystic fibrosis. Cystic fibrosis is the buildup of mucus in the lungs and the cause of many respiratory problems. The mucus can also build up in places like the pancreas, causing stomach problems. It has been found out that the reason for the mucus buildup starts in the rough endoplasmic reticulum when the organelle fails to export proteins. The reason this happens is the faulty gene affects the chaperones responsible for moving the proteins out of the rough ER. When this mutated chaperone fails to carry itself and its protein out of the rough ER, the result is a buildup of proteins and chaperones. The general prognosis of cystic fibrosis is that a patient should be fairly healthy until adulthood and be able to participate in most activities and should be able to attend school. However, the lung disease eventually worsens to the point where the person is disabled. The average lifespan for people with cystic fibrosis who actually live to adulthood is approximately 37 years, a dramatic increase over the last 3 decades. Death is usually eventually caused by lung complications. Cystic fibrosis can cause symptoms such as delayed growth, failure to gain weight normally during childhood, bowel dysfunction, weight loss, coughing, recurring cases of pneumonia, fever, shortness of breath, loss of appetite, sinus pain or pressure, infertility in men, and various respiratory problems. The diagnosis for cystic fibrosis is most commonly a blood test looking for variations or mutations in the gene known to cause this disease. You can also get a chest X-ray and lung function tests. Another common diagnosis is to get your sweat tested for salt content, since patients with cystic fibrosis tend to have a greater concentration of salt in their sweat. Although there is no known way to cure this disease, there are various treatments that can be done to improve the survival and quality of life of the patient. Once diagnosed, follow-up and monitoring are very important. If possible, the patient should be cared for at a cystic fibrosis specialty clinic, which can be found in many communities. When children reach adulthood, they should transfer to a cystic fibrosis specialty center for adults. Also, inhaled medicines can be helped to open the airways. Antibiotics may be used to prevent and treat lung and sinus infections, and patients can go through DNase enzyme therapy to thin mucus and make it easier to cough up and clear the lungs and airways. Now that we finally understand what causes cystic fibrosis, we may be able to find a cure to the mutant gene or develop a medication that goes all the way down to the cell level and will fix the problems with the proteins and the chaperones within the rough endoplasmic reticulum.